Wayne Kwong from Man vs. Prostate here with Dr. Joe Mann from Minnesota Urology. He is pioneering the IBPSS here in America for large urology groups. And thank you for jumping on and supporting this campaign. I mean, what do you think? And any tips and tricks on how docs can use this, or how does it benefit you and the patient?
Really, we talk to patients about going through a journey, and our IPSS was a nice tool, but it's hard to really put those numbers into a journey. With the IBPSS working through our stage system, it really helps clarify to patients what their trajectory is. Stages are used in all parts of medicine, and it's something that's been indoctrinated into patients to understand what is my stage. And so using the IBPSS, talking to them, talking about their scores, but more specifically, their journey through the stages of BPH and their urinary health really just helps clarify what our next steps is, what is the level of urgency we're in, how quickly do we need to add to preserve their bladder.
And having the word just simply bladder at the top, does that change the conversation?
Absolutely. When we're counseling our patients and about their urination, to focus only on the prostate, you're not getting the whole picture. The prostate and the bladder are two separate things working in concert with each other. And so I do think that the addition of the bladder, focusing on these stages, helps to put the whole puzzle together.
And for you, when you talk to them, they get the word stage, like it's a clicking word, or like how do they feel about that?
Oh, absolutely. I mean, think about stages in all other parts of medicine. Cancer staging, kidney disease staging. Patients have learned to understand the progression of medical stages. And so it's something that really just brings us into that already preformed understanding that patients have.
Right. They talk about not persuasion, but persuasion. Right. They're already primed because they understand the word stage.
Exactly.
And do you feel like it slows you down though, like in clinic, or do you feel like how is it helping or not helping with efficiency?
I think it speeds me up, and mostly because I don't have to get bogged down in, well, what is my score of 13? What is my score of 21 need? Get to frame that score into a much easier, more streamlined understanding for the patients.
So is it as simple as, hey, Mr. Smith, you're already in stage 3. That's not okay. We need diagnostics because something's at stake here. You can't transplant your bladder or...
Yeah. When you think about back when we didn't have these added metrics here, yeah, my score is 21, but my quality of life, it's 3. I don't know if I really want to do anything. Oh, no, sir, you're in stage 3. You're eventually going to progress if we don't do anything. That is something they can understand and wrap their heads around. And it gets that level of urgency, in play. And so they're ready to move on to diagnosis.
Wow. Hey, Joe, thank you. I appreciate it. And that's just one experience, and hopefully you guys can use it throughout the world and begin to extrapolate what works for you. And I think that's going to be an exciting journey for all of us on Man vs. Prostate. So thanks, man. I appreciate you.
Yeah. My pleasure, man. Take care.
Keep going. Keep defending the detruiser.